You know, it was really working with the WHO over the last several years to really understand what St. Jude brings to the table and what the World Health Organization brings to the table. We started partnering with them as we went into low and middle income countries to really develop workshops where we could bring in all the stakeholders from a country, from the physicians to leaders in healthcare to ministers of health, ministers of finance, and to really work in partnership with the WHO to really identify what the gaps are within a country that need to be filled to be able to effectively treat children with cancer. And so through those experiences in a number of countries, we realized that the two organizations really bring unique skills and unique expertise. And so the WHO really can work from the top down. They can work through the government, through other NGOs that are within the region, through policymakers, whereas St. Jude, we're really on the ground. We work with the healthcare providers, and we really have vast experience in the care of children with cancer and in really exporting that care to low and middle income countries. So by bringing these two world-class organizations together, we really can advance, I think, the outlook for children with cancer everywhere in the world. You know, so St. Jude has had an international effort for over 25 years, and it really started out with a program that we called the International Outreach Program, and that program was humanitarian in its effort. It really was, how do we go to a hospital in a low and middle income country, and how do we train the physicians and the healthcare providers in that hospital on how to treat children with cancer? And so we started in what we call a twinning approach to really train them, the physicians, the nurses, the healthcare leaders in those institutions, to treat children with cancer, to advance those cure rates, and really help to set up foundations that are associated with those hospitals so they could provide funding to help children and families move near those hospitals during the time of therapy. You know, I like to believe, and I firmly believe this, that in the end, the healthcare leaders like myself from developed countries have more to learn from our partners in low and middle income countries than they have to learn from us. By working together, by everybody coming together at this time, we are going to make progresses, not only in low and middle income countries, but we will make progresses in developed countries. And right now we have that 80% cure rate, but that still means 1 in 5 children in developed countries are dying from cancer. And so how do we also address that? And that, I think, is part of this overall effort. And when Danny Thomas founded St. Jude, you know, he said no child should die in the dawn of life. And he didn't limit that to the United States. He didn't limit that to just developed countries. He really left it open that no child, no matter where they are in the world, should die in the dawn of their life from a disease that if we work together, if we figure out we can cure that disease. And so this expansion into a global network is really in our DNA. It is really what St. Jude is about. It is really, in our mind, something we have to do. It is something that we are positioned now to step up and to help bring the community together to accomplish this. And it is, I think, one of the greatest things that St. Jude will ever accomplish.
Through this collaboration with WHO, St. Jude is trying to strengthen the systems at a global level so that all children with cancer can have access to care and have the best chances to be cured. So, as you know, probably more than 300,000 children are diagnosed or develop cancer every year around the world. And probably half of those, maybe a little bit over half of those, get diagnosed and get to have some access to care. But overall, we think that probably 80 to 90% of all children with cancer in the world die nowadays. So this calls for a global response. And so with the WHO initiative, St. Jude is trying to address this global problem by developing a global response together with WHO and other stakeholders. Our overall goal is that by 2030, so that's a little over 12 years from now, we will have been able to bring all these children that develop cancer to a system that can receive them and can address the urgent problems that these children face. and then that during this time we can increase the chances of these kids to be cured. So we have set some goals, like 60% of children with the most common cancers could be cured by 2030. So as you know, St. Jude has the St. Jude Global Initiative, the St. Jude Global Program, which is developed from or within St. Jude to expand St. Jude reach to the world. So the St. Jude Global, as you know, we are working with hospitals, with governments to develop capacity, train the workforce, develop structures to support the care and improve the care of children with cancer. But this is not enough. So for us and other partners to be able to really advance care to children with cancer, we need to work with the global agencies. WHO, as you know, has the convening power to bring governments, non-governmental agencies behind a cause. And by raising childhood cancer to that level of a public health interest means that governments will start adjusting their resources, prioritizing initiatives to facilitate the access and quality of care for children with cancer. So in a way, we are working as St. Jude from bottom up, just working at the patient side, at the bedside, helping programs build capacity, while at the same time we hope that WHO will help us mobilize the resources at a global level to help governments facilitate this process. But again, this is not a St. Jude only initiative, so St. Jude is one of the main partners, but there are many other organizations that are joining these efforts to advance care, working together with WHO, parents organizations, big international agencies, other hospitals like St. Jude, other academic organizations. This is going to be a global movement that will include many stakeholders. So the first of such initiative was approximately 2.5 years ago in Myanmar, when we, together with WHO, were able to develop a national cancer control plan workshop. WHO was able to bring to the table the government, the university, all the healthcare systems, all the stakeholders, and together with St. Jude were able to develop in a short period of time a good strategy for Myanmar to develop a national cancer control plan. Over 2 years or 3 years we have seen enormous progress by working with the government on that. So the government was able to develop some priorities, reallocate some resources, improve access to care, access to drugs, develop better structures for diagnosis and treatment. Then we have extended that to other countries. We have done similar initiatives in the Philippines or in Central America or in many countries in South America, in parts of Central Asia, etc. So for us, we have seen firsthand how powerful it is, the influence of WHO, their convening power to really make things happen. We have seen hundreds of thousands of children that are alive today, young adults, because one day they had access to life-saving treatments. Around the world, this doesn't happen. Every day, children die in pain, children die in agony. They have never been given that chance of cure. They have never been given that hope. And yet there are all these anonymous doctors, anonymous nurses and healthcare providers that day after day after day keep trying. For us, this is a unique opportunity to give everyone that chance. The children to have access to care, their parents to see their children stop suffering and crying. To give these children the chance of cure, to give these parents the chance of embracing and kissing their children for the rest of their lives, but also to give the chance to all the doctors, all the nurses that for so many years have worked so hard to really have the chance to give the gift of life to all their patients when for many years they haven't been able to.